the carbon monoxide, basically we want to look at the poisoning of this. Carbon monoxide, it's a colorless, odorless gas. Okay, so you won't even know you're breathing, it looks like. So basically this comes from burning of organic fuels. So people who are using LPG, etc. in a closed environment, especially like bathrooms, they will be breathing carbon monoxide without having the knowledge that they are breathing it. So this is very dangerous. Now, even from vehicle exhaust fumes, you can have carbon monoxide. So that is why people who sleep in garages with their cars on, for the sake of AC, etc., they will be breathing carbon monoxide. They'll have no idea because it is colorless and odorless. Okay. So even smoke from house fires, that's how people die sometimes, not directly because of the fire, but because of the gases. So how does this carbon monoxide affect us? It binds with hemoglobin and cytochrome oxidase, so it will reduce the oxygen delivery. So whose job is it, guys, to give you oxygen? Hemoglobin has to carry the oxygen, right? So here you have the red blood cell, let's say, and in the red blood cell you have what? You have hemoglobin. Let's make that which color? Actually, hemoglobin. Now it is not oxygenated. Once oxygen comes, it will look nice red, let us say. So this is how it is carrying oxygen. But now what you are saying is, instead of oxygen, this hemoglobin is binding to carbon monoxide. Carbon monoxide is colorless. So now this hemoglobin is bound to what? Carbon monoxide and not oxygen. And carbon monoxide has more strength of, more affinity towards this hemoglobin. Both of these, hemoglobin and carbon monoxide, are more compatible, or what you say, more friendly than oxygen. So carbon monoxide is going to replace the oxygen, and tissue oxygen delivery will stop, right? So there will be inhibiting cellular respiration. It is a common cause of death, right? They will die before reaching the hospital, it says. So we are looking at poisoning, like we told you. So what will be the clinical features? Standard, you write nausea, irritability, headache, tachypnea. Okay, that means he's breathing fast, isn't it? So there will be some non-specific features. You won't even know what has happened, especially from a long time if they have been exposed. Like if they are cooking domestic appliance, etc., faulty domestic appliances there, they won't even know from such a long time, and there will be non-specific features. Anyways, finally, coma, convulsions, hypotension, respiratory depression, death. All the standard things you can write. Okay, that's how the poison is killing, isn't it? So they can have arrhythmias, myocardial infarction. Imagine somebody comes and you won't even know why it happened. You will be treating, you don't even know why it happened. Okay. Cerebral edema, rhabdomyolysis. There will be myoglobinuria, renal failure. Just write everything on earth because of this poison, guys. Kidney affected, heart affected, everything affected. Okay. Then if they recover also, then they can have some long-term neuropsychiatric effects. That is sad. Oh, if they don't die, then they can have neuropsychiatric effects. Okay, personality change. That's interesting. Personality itself changes, memory losses, concentration impairment. Okay, no wonder they are asking this in the examination. Extrapyramidal effects will be there, like urinary and fecal incontinence. Okay, gait disturbance. They won't walk properly. If in pregnancy this poisoning happens, there can be fetal hypoxia, obviously, and intrauterine, the baby can die. Okay, now don't get scared too much. Let us look at the management. Ready? Okay. So here's the management, guys. So you should remove them from the exposure. That's the standard thing that you will write. Then high concentration of oxygen you will give. Just say high concentration of oxygen, okay. So what will happen if you give high concentration of oxygen? So much oxygen, the hemoglobin will have to bind. Instead of carboxyhemoglobin, it will become oxyhemoglobin, right? See, carboxyhemoglobin refers to carbon monoxide, not carbon dioxide, okay. So that is what is interesting here. So you will measure the carboxyhemoglobin level and you will give the oxygen, looks like. Okay, just give oxygen, high concentration, so that you will reduce the half-life of carboxyhemoglobin. So the hemoglobin will dissociate from carbon monoxide and try to bind to the oxygen. So you will restore the oxygen supply to these tissues. Okay. ECG you will perform because we told you heart, etc. It can affect. Okay. You will check the blood gas, arterial blood gas analysis. You will check. Pulse oximetry may provide misleading oxygen saturation. Oh my god, pulse oximeters measure both carboxyhemoglobin and oxyhemoglobin. It measures both. Now wait, these pulse oximeters are really bad then. They cannot distinguish between carboxyhemoglobin or oxyhemoglobin. Okay, so just do an arterial blood gas. So arterial blood gas will tell you bicarbonate, pH, oxygen level, carbon dioxide level, etc. Right? So do arterial blood gas. Okay guys, did you understand? What did you understand? Arterial blood gas you do. Don't do pulse oximeter will give you wrong reading. Okay. Do not give. Okay, then where were we? You should not give IV fluids, guys. This is what is strange. Okay, especially in elderly. So because these people are already, they are telling edema, more fluid if you give, that will be bad, right? So that is something. Go back here, and in this edema thing is there, no? Cerebral edema. So you should not give excess fluids, okay? Right, this excess fluid should be avoided because of cerebral edema. Then convulsions can be controlled. If these people have that coma, convulsions and all, you read, right? In that, if they have convulsions, you will give diazepam. This is standard symptomatic treatment. Hyperbaric oxygen, they are saying, is controversial. You will see all this in those medical series and all, hyperbaric oxygen and all. This is controversial, they are saying. But anyways, we will write this in the exam, right, for getting marks. So, what is the treatment for carbon monoxide poisoning? You should remove the person from the exposure. High concentration oxygen you should give. Then supportive treatment only. You will check the ECG, arterial blood gas. Don't give fluids. Don't use pulse oximeter to know the oxygen saturation. If they have convulsions, give diazepam. Hyperbaric oxygen, they are not very sure that it will help. Okay. So this completes our carbon monoxide poisoning.